Glennis, may I know where do you live?
I'm from Bombay, but we live in Abu Dhabi.
Okay. So here in this clinic you had come for what purpose?
I had come for my son, who is 11 years now. Came 1 year back, so that time he would have been 10. For we noticed a small patch on his hair, and then it was diagnosed as it's alopecia. So that's the reason why we came here. He used to be continuously every couple of months he used to fall sick, and we used to give all other kind of medication. And then when we noticed this kind of patch, we had visited a doctor in Abu Dhabi, and then they prescribed some creams, and then they said that you might have to go and give some kind of injections which are considered as steroids. So we were not comfortable with that, and we thought we need to look into for other more better resources for medication, and that's how I was referred here by my cousin who's been coming here, and that's how we wanted to opt in for homeopathy instead of any other medication like steroids for him.
So recurrently he was falling sick means what problem he was having?
He used to get cold, cough, heavy wheezing. Always he had little bit of nose, because and then nose like breathing issues in the night. Then he used to put his finger and then it used to start bleeding. So heavy wheezing issue he used to have.
And do you remember the name of that allopathic medicine he was taking for
It
wheezing?
was Ventolin.
Ventorlin, right.
And there was another one, I'm not too sure of the name, but
Fluticasone? Fluticasone?
maybe, or Budicort. Ventolin, I remember he used to
Right.
be. He used to take the
Budicort.
pump. Yeah.
Okay. And any ear problem he was having?
No, but what used to trigger is that when he used to get this continuous cold and cough, it used to trigger either a nose infection or a ear infection.
Fine. So now since how many months you are taking treatment here? If you
Almost a
remember.
year. So
Okay.
1 year, maybe 3 months. Yeah.
Right. So during this period now, what response you have seen?
I am pretty much impressed with the response. We noticed that one patch which had started in like almost 1 year back, now today that patch is completely closed. No doubt it did progress to a little bit to other areas, but the progress is a bit slow. But when I seen the improvement and I seen hair growing and now that patch is covered, it does make me feel really happy. And when you look at this kind of progress, I know that if I monitor his health and change his food lifestyle, I am going to see more progress in the future.
And as far as his recurrent falling sick, cold and cough in that area, what this response you have observed?
We do not go now much to the doctors. In case if it is a dire emergency, I might need to go to the hospital in UAE. But we do not visit the doctors. Like if you consider the frequency, what we used to visit earlier used to be like every month or every 1.5, 2 months we were going to the doctor. But now we barely go. And actually, I just call Dr. Sunil and he'll tell me what kind of medication to take, and I just give them that kind of medication for cold or cough.
Online.
Online, yes, completely online. I just message him on WhatsApp, and he will tell me what kind of medication to take. If I need to do a call, because I'm based in UAE, I had to do the call on bottom to doctor.
Fine. So any you have a second child also, no? She's
Yes.
daughter.
Yes.
So as far as she's concerned, what is the experience?
I don't take her. We are completely on homeopathy medicine made for her. Even if she gets a slightest cold because of school and she's in like kindergarten, she picks up these kind of things in school. I'll immediately message doctor and tell I feel like she's developing a cold or she's sneezing a lot, and he will prescribe medication. I do not have any other concerns with her. She did have a little bit of constipation issue, but doctor advised us to change her food lifestyle, her food habits, and we do see a good improvement now as well.
So now in nutshell, can you tell us what do you have anything to say about the services provided here, about the doctor or the assistants?
I am very happy because I know that there is not a big time difference between us. I'm just 1.5 hour time difference, but I can message doctor anytime and he does respond to me immediately. and he'll also follow up, like, take this medication for 2 days, and then give me a report, or give me an update how the progress is, and I'll update him immediately on the phone, and we take it forward from there. But the service is so good that it's everything by a phone. I cannot come here physically. I do visit here every couple of months, but otherwise everything is done via the phone.
Okay, and do you have any feedback for us where there we need to improve ourselves? So you can tell us here on.
So currently, I'm pretty happy with the service. So I have no issues. Doctor does give me a preference when I come down. I'm not struggling with any appointment because he does give me my preference, because I come down for a short period of time and otherwise on phone. So I'm that kind of service. I mean, this is what you want when you come down for a short period. You want to visit the doctor, and get your medication, get everything, take all your stock. So I'm pretty happy with that kind of service.
Any specific suggestions for mothers, other mothers?
Mothers, I would say to start at an early age to control the children with their food habits, because I know my son and my daughter were getting a lot of addicted to kind of chips and juice. We have completely, after coming here and listening to other people's stories as well, we have completely changed our food habits in our house, with regards to food and junk food. Now we do not provide them. There is no option of giving. I know they are children. It's really difficult, but sometimes they do, want to have something. But we have controlled that drastically. I would say almost about 95% of the time we are trying to control it. So for parents, I would say start early so they do not get exposed to these kind of things, and try to educate them on the good things about the food.
Gladys, we are really grateful to you for your feedback. Thanks a lot.
Thank you.
Okay.